Brian, I welcome you to the stage and really looking forward to your presentation.
Thank you, Rachel. We're very happy to be able to present this work here today. I also just want to say a quick thanks to Orla and Terry in the department who helped us identify some of the research questions and identify some of the health graduates, and so they helped us along with this. So just in terms of an overview of what I'll go through today, I'll run through just a background to the CSO and our project here, data sources that we use and how we match the data. I'll go through the number of health graduates and then the outcomes for those health graduates in terms of their employment and education profiles. And then I'll look at how many graduates emigrate and how many subsequently return, when do they first emigrate, and how long do they emigrate for. So by way of background, the aim of the CSO is to play a coordination role across the Irish statistical system in the civil and public service. And this is to support better and deeper analytics and policy development across the public service when we link data. And that's using those identifiers. They're the unique identifiers across businesses, persons, and households. So in doing this, we developed the Educational Longitudinal Database, and this is a framework to analyse learner outcomes from post-primary level to adult education, and then to track their outcomes into the labour market. So the data sources that's used here is we take our higher education graduates from the Higher Education Authority, and that's our medicine and nursing and midwifery graduates. And then we see if they're re-enrolled in education in higher education using, again, the Higher Education Authority's enrolment data set. And then if they're employed as an employee with revenue, or self-employment record with revenue, or are in receipt of a social protection payment from the Department of Social Protection. So just to show the timeline of data availability that we have graduation cohorts from the HEA from 2010 to 2020. And then we have outcomes data from the HEA revenue, from the re-enrolled in education, the employment and self-employment, and social protection records from 2011 to 2021. So for the 2010 graduation cohort, we have 11 years of outcomes for this cohort. And then, look, obviously this is sensitive population level records. So we have to mention how we match this data, and our protocol is when the data comes into the CSO, personal identifiers are removed, so that's name, addresses, and date of birth. And then the PPS number is replaced with a protected identifier key. And then it's on this protected identifier key that we match the data sets from the different public bodies. So anytime I mention PPSN number, I'm referring to this person identifier key, because personally I've never seen a PPS number while working in the CSO. And then what allows us to do all this data matching is the Statistics Act from 1993. Specifically, it's Section 30 that allows us to collect that data from public authorities. So that's from DSP, Revenue, and the Higher Education Authority. Our extensive data matching proposal is available, or data matching protocol is available online. But just, I suppose, high-level takeaway from it is that access is restricted to officers of statistics, which are CSO staff, and then even within that, access to the data sources is controlled to those who have a statistical need. So I can only access that data that I have a statistical need to use. There's a data minimization policy that we only collect the data that we have a statistical purpose for. And anytime we link data across from different public sector bodies, that's published online in a data protocol register for transparency. So before looking at the number of health graduates, I'll just define the the cohort that we're looking at medicine and nursing and midwifery graduates who completed an FQ level 8 full-time undergraduate programme in one of Ireland's institutes of technology universities or technological universities. And these are programmes that lead to a recognition with the Irish Medical Council or the Nursing and Midwifery Board of Ireland. And we identified these using course name, course code, and the CAO code, and obviously went back the 10 years or back to 2010. And then it's also to point out at this point is that we can only measure outcomes for graduates that have a PPSN number when they register at the point of going to college, and that non-Irish students don't have to get a PPS number to register to go to college. They only get a PPSN number if they're seeking employment. So that's why we have a much higher PPSN coverage for our Irish graduates. So we'll see now, but analysis is restricted to Irish graduates with a PPS number. So this is the number of medicine graduates from 2010 to 2020. The dark green line there at the top is the total number, and then we see about half of them are Irish, and then we've pretty good PPSN coverage for that cohort. It's over 85%. You'll notice also a dip in 2012, especially in the total graduates, or CSI graduates were removed in 2012. It was just a data quality issue, so that explains the significant drop-off there. But then also just to point out, this is the number of Irish medicine graduates by institution, and the dark green furthest in on the left-hand side is RCSI graduates, where those records were missing PPSN in 2016, 2014, 13. So that's just one of the constraints on the data, that there was a lack of PPSN coverage. But we don't have that problem for nursing and midwifery graduates. Most are Irish, and we have PPSN for most of them, so it's a very representative cohort. Then before we look at their outcomes, I'll just define the 5 outcome categories that we specify. The first is substantial employment, and that's if they've 12 weeks of employment in a calendar year, earning at least €100 per week. Then substantial employment in education, so that's they've been employment and re-enrolled in a higher education course. There's education only, and then there's what we call neither employment nor education. So for this cohort, it's probably mostly that they're just employed for less than 12 weeks in the calendar year, or that they're in receipt of a payment from social protection. This not captured category then is everybody else that we basically just don't capture in those administrative records. So they're not paying taxes, they're not receiving a benefit from social protection, and they're not re-enrolled in higher education. So to all intents and purposes, we assume that this cohort have emigrated, but there's no definitive emigration register available, or there's no data point to specifically say that they've emigrated. It's just an assumption. So I'll be referring to not captured and emigration interchangeably. So this graph here shows the those 5 outcome categories for medicine graduates from 2010 to 2013, and their outcomes 1 to 8 years after they graduate. So you can see in the bottom, the first year after graduation, that there's very few not captured. They're practically all in substantial employment and education as they complete their internship year. And then 2 years after graduation, about 80% of them are in substantial employment. And then after 8 years, it's about 75% of medicine graduates are in substantial employment. And then for nurses and midwives, 1 year after graduation, around 80% of those graduates are in substantial employment or in education. And then this falls back a little bit to about 70% after 3 to 5 years. but then increases back to 80% in substantial employment or education after 8 years. But this is we'll say a repeated cross-section view at a point in time of 1, 3, or 5, 8 years after graduating. So looking at it at a longitudinal perspective as to how many emigrate for at least 1 year and then how many return. We do that here for medicine graduates. It's in the first column is the total number of Irish medicine graduates. So in 2010 there was 265 graduates, and we see that in that 11-year period after they graduate, 95 of those graduates have emigrated for at least 1 calendar year. But then of those 95, 45 subsequently returned in that same 11-year period. So overall, it's about a third of medicine graduates emigrate for at least a year. And then of those that emigrate, about 40 to even 60% for the 2016 cohort returned to work or education. And then for nurses and midwives, it's broadly similar. In the 2010 cohort, there 40% of those graduates emigrated, and of that, 65% returned in that 11-year period. And then for the 2016 cohort, that's looking at a 5-year period, about a quarter emigrated for at least 1 year, and then a third of those returned. So even in a 5-year period, there's substantial international mobility into and out of the country. So then, if they emigrate, we looked at when do graduates first emigrate. So I suppose it's still, I should really be using the term, it's the number of years since they graduated that they were first not captured, because they're just not captured in the administrative records. So for medicine graduates in 2010, about half of those graduates first emigrated 2 to 3 years after graduating. But then it's about 8% first emigrated after each of years 7, 8, and 9. So if you like, their emigration pattern kind of continued over the, we'll say over the years. And then for the 2016 cohort, over a 5-year period, 70% were first emigrated within the first 2 years. But for nurses and midwives here, most of those graduates, I think in contrast to the medicine graduates, for the most part, nurses and midwives first emigrated within the first 1 to 2 years. So for the 2010 cohort, there 70% of those graduates were first emigrated within 2 years. And then similarly for the 2016 cohort, it's the first within the first 3 years, 70% of them emigrated for the first time. But it's the nurses and midwives seem more likely to emigrate sooner, immediately after graduation. So then we look at how long graduates actually emigrate for when they are not captured. So this shows the number of years that medicine graduates emigrated 5 years after graduation. And for the 2010 cohort, we'll see that 80% of those graduates had not emigrated at all, and that 8% had only emigrated for 1 year in that 5-year period. And then for the 2016 cohort, it's about 70% hadn't emigrated at all, and then 15% had only emigrated for 1 year, and a further 5% for only 2 years in that 5-year period. So then looking at this 10 years after graduation, you only have the 2010 and 2011 cohort. We see that 65% of those medicine graduates had never emigrated, and that only 8% of those had emigrated for only 1 year. And that for that 2011 cohort, 9 or 10% of graduates had only emigrated for the whole 9 to 10 year period. So there's still a substantial cohort of medicine graduates that had never emigrated or only emigrated for a short period of time. And then for nurses, for the 2010 graduates, 60% had never emigrated, and 8% of graduates had emigrated for only 1 year, and that's 5 years after graduation. And then for the 2016 cohort, it's even they're less likely to emigrate. That 75% had never emigrated, and that less than 5% of those had emigrated for 4 or 5 years. So finally, we look at the number the same for nurses and midwives after 10 years. That for the 2011 cohort, that 65% of those had never emigrated, and that about 15% of those had emigrated for less than 3 years. And of that same 2011 cohort, about 7% of those graduates had emigrated for 9 or 10 years, so over the whole period. So these stats are available online in a release published today. It's on the CSO website under latest releases, but we intend to follow it up with a second iteration to look at where do graduates work in terms of their sector of employment. So that would be detailed NACE code like hospital activities or general practice activities, and then a public-private sector breakdown or employment sector breakdown there too. And then we can also look at what do health graduates earn from the revenue tax records, and advance notification of that will be published in the usual way on the CSO's release calendar. So with that, I'll wrap up, and happy to take any questions.